other Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topics, staph infections and impetigo. Good morning, Dr. Brady.
Good morning.
Okay, I've heard these words, not exactly sure what they are. They're correlated, though, staph and impetigo, right?
Right. Impetigo is a skin condition, an infection that generally affects 2 to 6-year-olds. It's highly contagious, and about half of it is caused by staph and half by strep. So if you have impetigo, you should get it treated, and you should have your child out of school so that the whole class doesn't catch it.
Right.
Because it is highly contagious.
Okay.
Staph infections in general can become pretty serious pretty rapidly, and they're dangerous. So staph infections should also be treated. Historically, staph only affected immunocompromised patients, patients with cancer on chemotherapy, dialysis patients, and other patients that had immune suppression. But now staph is much more common. You can catch it easily, and it can cause serious conditions in the rest of the body, and as you say, it can be deadly. Some of the serious infections that staph can cause are pericarditis. Probably the most common is pneumonia, meningitis of the brain and spinal cord, and they're serious to treat. They're easily spread. Alawai Canal water and sometimes other water, think of our paddlers, can get staph infections which become crusty lesions with a red halo and yellowish crust on the lesion, on the ulcer. They can be spread in daycare centers, playgrounds, locker rooms, at school, in gyms, in workout facilities, and even in bug bites.
Wow. How does that work, bug bites?
The bug causes a break in the skin, and the staph, which frequently inhabits all of our skins, takes advantage of the wound.
Oh, interesting. And then you mentioned, I mean, you know, daycare, school, so this really can impact anyone at any age.
Yes.
Okay, so if you do catch this highly contagious infection, are there treatments? How do you take care of it?
Yes, antibiotics are very helpful. There are many antibiotics that work. Your doctor, when you see your doctor, should probably take a culture to find out whether the staph is a regular staph or whether it's that bad staph that we talk about, MRSA, which is methicillin-resistant Staph aureus, which requires special antibiotics. So your doctor can treat that with antibiotics. Frequent bandage changes over the wounds will help, and when you're changing the bandage, be sure to wear gloves and wash your hands after changing the bandage. Proper disposal of the bandages and the gloves is important as well.
Yeah, and I'm sure that's a good way to not transfer it, right?
Right.
So what are other ways? I mean, you know, we talked about treating it, but is there a way to prevent it? I mean, with it being so highly contagious, with bug bites, are there ways to actually avoid it?
Yes,
okay.
Avoid Alawai Canal. Hand washing with soap, alcohol-based sanitizers, which are common, I think, at KHON. We even have them. Don't share towels with people that have sores on their skin, because you can actually infect yourself with the same staph. Keep broken skin covered with a bandage. If you have sports equipment you're using, clean it. Be sure to, again, not share towels, and keep wounds from eczema or other skin wounds treated with creams and keep them covered.
Good tips. Okay, so basically just keep everything very, very clean.
Right.
All right, thank you so much, Dr. Brady, for joining us this morning for breaking down staph infection, because again, it can infect anyone of all ages and is very contagious.
Very contagious.
Thank you, Dr. Brady.
You're welcome.
All right, we'll see you next week.
Yes, indeed.